We are following a tragic situation that's unfolding at a long-term care facility.
This is a national disgrace.
How long can my grandmother last?
There's been no shortage of heartbreak from our seniors' residences throughout the pandemic, adding to an already horrific history when it comes to Canada's long-term care homes. In this past year, more than 16,000 deaths have been associated with the very institutions meant to protect our most vulnerable. The pandemic shining a new light on institutionalized ageism, mismanaged resources, and how staffers in the system need more help than ever before. But will COVID finally force the change so badly needed to combat Canada's crisis in care?
Welcome back. Well, we are kicking off a brand new series on The Social entitled Crisis in Care. This is where we will be delving into the issues and, frankly, the tragedies in Canada's long-term care facilities. Today, helping us kick off this conversation is reporter and health columnist at the Globe and Mail and also author of a book entitled Neglected No More, The Urgent Need to Improve the Lives of Canada's Elders in the Wake of a Pandemic. We are so pleased to welcome to the show André Picard. Welcome, André.
Hi.
André, you open the book with these sobering words, which are, when elder care makes headlines in Canada, it's usually news of the worst kind. And even before the pandemic, there were really countless reports and exposés, inquiries about the conditions at senior residences. And yet you write that very few of the recommendations are ever implemented. Why is that?
Well, it is a chronic problem. You know, we've known that there's been problems in this sector for decades. And the why is the big question. Why haven't politicians acted? I think it's largely our policies are kind of inherently ageist. We kind of send older people off to places to live outside of the view of society. And they're just easy to forget. So it just gets forgotten, or a lot of promises, but they're never followed through on. So I think this pandemic has really shone a bright spotlight on the failings of the sector, and we have to once and for all fix it.
So do you think, though, André, in your reporting, have you found that there is both the political will to actually, do the deep research and then take action on recommendations, and the public will as well to perhaps have to back costs that will be entailed in really modernizing the system? Do we have enough of both?
I think we do theoretically. I think we have the political will. The politicians talk a good game on this. I think the public wants it to change. I think what's been the impediment is sort of this nihilism, it's going to be too expensive, it's too complicated, there's too much to do. And I think none of those things are true. I think all the solutions are there. The ability to fix this is there. And we just have to have, a philosophical shift. We have to once and for all say, we value our elders. We want them to stay in society as long as possible. We have to appreciate elders collectively as much as we do individually. Everybody loves their mom and their grandma, but we have to have that in our public policies as well.
So when pandemic restrictions began, we were unable to visit any of our loved ones if they were in long-term care facilities, which led to an incredible amount of loneliness. And you've written about the health impacts of loneliness for years, and I understand your father-in-law was impacted by this too. Can you share that story?
Yeah, so my father-in-law died during COVID, not of COVID, but he was a very healthy 88-year-old man who played tennis 3 times a week, went to church every day, played bridge almost daily, and he was crushed by the lockdown. He was, immobile. His health went really rapidly downhill, especially his mental health. He kind of lost the will to live, unfortunately, and that happened to many, many people. It's not an unusual story. It's really difficult to measure the collateral damage. Beyond, we had so many COVID deaths, 16,000 in long-term care homes alone, but beyond that, there's that collateral damage to the mental health, to people losing their contact, their health deteriorating, and that we'll never be able to measure. But it's a real issue, and we absolutely didn't get that balance right. By locking out families, we denied people of really essential care and of essential contact. And as you said, loneliness, isolation, they are deadly in themselves.
I was shocked, André, to read in your book how deeply you go into the historical origins of long-term care facilities. And perhaps many people would go into it thinking, oh, well, they're an evolution. They've grown out of the healthcare system in health and caring for our elders. But in fact, it is a system that was grown out of or evolved from the penal system. Can you give us a little description of how that came to be?
Yeah, I'm always interested in the history of medicine, the history of policy, because it often helps explain the problems we have today, and that's very much the case with long-term care. So this grew out of the Elizabethan Poor Laws of 1601. This is the whole foundation of our welfare system, that they're essentially deserving poor, and there are others who are not as deserving. So we used to essentially make people work for their room and board, regardless of their age. So if you were older, you didn't have family, you were poor, you got shunted off to one of these workhouses. And that was the reality. In England, we brought that system to Canada with immigration, with the Europeans arriving here. And it actually existed for a long time. People are always surprised when I tell them that until 1961 in Ontario, you could still be forced to work for your meals and for your room and board if you were an elderly person. People used to wear uniforms like prisoners. Our homes, even to this day, they look very much like prisons, right? They're 3-4 beds to a room. People eat in a congregate setting, and that the history is reflected in the infrastructure and in the policies. And we haven't totally shaken that off. It ended in the 60s, but it's still the philosophy, the structure is still there, unfortunately.
Your book also shares how much of the working conditions for those who work in long-term care facilities has been exposed in this pandemic as well. And you share the story of a woman named Josephine. What did she share with you?
Yeah, so Josephine is a personal support worker in British Columbia who's been at the job for many years. So a lot of our PSWs come and go. There's lots of turnover, but there's this core of lifers, people who work there forever. She's one of them. So she's worked a quarter century doing this really hard, backbreaking work. She loves it. But she talked about how she gets paid the same today as she did 25 years ago. The work she does double the work. The patients are much more acutely ill. She has no time to chat with people anymore. You know, there was a time when support workers provided that connection. They could have tea with the residents, et cetera. None of that happens anymore. It's become this assembly line of tasks. So I told her story just to use it to talk about how the workplace has changed and how it's not changed for the better. And as you said, it's a really important concept. The sociologist Pat Armstrong famously said, you know, the conditions of work are the conditions of care. So when we pay our employees badly, when we don't give them time to work properly, et cetera, they're never going to be able to deliver good care. And that's the reality that was really exposed by COVID-19, is the lack of personnel, the lack of ability to care for people in a way that the workers would like to and the residents need.
So what are the essential questions that you think any family needs to ask before a decision is made about putting an older loved one or finding a new home for an older loved one in a long-term care facility?
I think there's a couple of things. I think, unfortunately, the way our system is built, it becomes the default mechanism. So families have far too little choice. So they should really be insisting on that. I want choice. I want some home care. I want to keep my loved one in the community as long as possible. That should be our philosophy. That's what has to change fundamentally. When you're forced to make this decision, and I had to do it with my parents, it's a tough decision. It's really heart-wrenching, and you're given so little time. You're often given, you have 24 hours to decide, take the bed, or else you go to the bottom of the list. You might have to wait another year or 2 years. And when people are making this decision, they're often making it at a time of terrible crisis. We have exploited our family caregivers for a long time. We drive them to the verge of burnout. And then we say, okay, you have to decide immediately. So people have to push for more time. They have to push for more planning, more continuity of care. You know, I'm not saying that homes aren't needed, but they should be needed a lot less, and they should be needed in a more structured fashion. We should know the route that people are going to follow through their illness and get the appropriate care. So all of these things, there's way too much pressure and way too little information for families to make good decisions. So it's really the system that has to change.
André, thank you so much for joining us today and for all of your important work.
And thank you for your interest.
André's columns appear in the Globe and Mail, and the book is called Neglected No More. Be sure to check it out. We'll be right back.